Okay, good morning, everybody. Welcome back to our 8th episode of the Happy Hearing podcast. Today, we have a very exciting guest, Dr. Christian Russo from Family Chiropractic and Injury in Shrub Oaks. He is not only a doctor of chiropractic, but he is also the councilman at Putnam Valley, New York. I'm going to first introduce Carly Sygrove, my co-host, and then we will get started on some exciting topics today. Carly, take the floor.
Hi, everyone, and welcome back to the Happy Hearing podcast. This is episode 8 today. I'm Carly Sygrove. I'm a hearing loss coach and hearing health advocate and writer. And as my co-host, Dr. Ruth, has said, we're joined today by Dr. Russo. Now, I'd like to say welcome to Dr. Russo.
Hi, guys. Good morning and good afternoon. Thank you.
Would you like to tell us a little bit about yourself to begin with, and maybe how you got into chiropractic medicine?
Sure. Again, my name's Dr. Christian Russo. My practice is in Shrub Oak, New York. I got into chiropractic medicine. What happened was when I was 14 years old, I was involved in a pretty bad car accident. The car rolled over several times. And as a result, I suffered a couple of herniated discs in my neck. I was suffering from quite a bit of neck pain and radiating pain that was going down into my arm. At the time, my parents had taken me to an orthopedist who had suggested that I try physical therapy. I did go. There was some positive results from the physical therapy, but my arm was still feeling numb. I was still having some pain. And one of my mother's friends suggested that I go to a chiropractor that she had been visiting. She said he had worked wonders for her. So my mom took me to this Dr. Terrence Murphy. He was in Yorktown, New York, just a town away. And Dr. Murphy had evaluated me, did some imaging, and he started doing traction on my neck and some gentle adjustments on me, working through the soft tissues of my neck. And within, a few weeks, he had really resolved my symptoms completely. I really liked how the adjustments felt. I really did feel loose afterward. And at the time, I was competing pretty seriously in the sport of Taekwondo. I was competing at a national level. So I kept going for the adjustments basically for wellness. So as I got to the college years, I asked Dr. Murphy, I said, Doc, do you like being a chiropractor? And he said, I love being a chiropractor. If I hit the lottery, I would continue practicing chiropractic. So I said, I'm sort of interested in doing this. And what ended up happening was he sort of walked me through. I kept in touch with him through the 4 years of undergrad. I majored in biology, minored in chemistry. And then he wrote me a letter of recommendation for chiropractic school. I attended the University of Bridgeport College of Chiropractic. I received my doctorate there. And when I graduated, he said, what's your plan, Doc? I said, I'm going to go open up a practice. And he goes, I'll tell you what, before you go do that, he goes, why don't you, I apologize for the phones, guys. Why don't you start off in my office, taking some patients, a couple at a time. And once you build up, you can go open your own office. So I did that, practiced with him for a few years. And several years later, he ended up semi-retiring and he now practices in my office with me. So that's my chiropractic story. So
you came full circle.
Full circle.
I love that.
Full circle. Yes. So, and he's been a mentor to me, tremendous mentor to me. So.
Yeah, that's especially when you're first coming into the field at that point. It's great to have someone that really serves as like a guide, right? As a like you said, a mentor.
Yep. So it was wonderful. So.
I never knew that story. Thanks.
Yep. Ironically enough, he also served as a New York State senator. So he's sort of mentored me in the political
side
also.
too.
He's been a tremendous mentor to me. So wonderful guy.
Amazing.
Wow.
When I reached out to you to do this podcast, I was really curious because I do get a lot of questions from patients about, how chiropractic can help how chiropractic medicine can help with the ears. I guess maybe there's a little bit of history behind that, which I didn't know about. If Carly, you wanted to share that story, and then we could ask some patient questions.
Yeah, shall I begin with the story?
Yep.
Yeah.
Okay, right. So I Googled this because I see a chiropractor regularly, and I have neck problems, and I also have hearing loss. And when I first lost my hearing, I was trying to do everything to get it back. So I went to see a chiropractor quite early on, and actually he's been amazing for my overall wellness as well, like you were talking about, um, Dr. Russo. But Google tells me, now we all know we can trust Google. Google tells me on Wikipedia, bear with me, this is quite long. The history of chiropractic began in 1895 when Daniel David Palmer of Iowa performed the first chiropractic adjustment on a partially deaf janitor whose name was Harvey Lillard. Now, Palmer claims to have had principles of chiropractic treatment passed along to him during a seance by a long dead doctor named Dr. Jim Atkinson. While Lillard was working without his shirt on in Palmer's office, he bent over to pick up an empty trash can. And when he did this, Palmer noticed that he had a vertebra out of position, and he asked Lillard what happened. And Lillard replied, I moved the wrong way, and I heard a pop in my back, and that's when I lost my hearing. So Palmer had Lillard lie face down on the floor and proceeded with the adjustments. The next day, Lillard told Palmer, I can hear the rackets on the street. Now, I'm wondering how much truth is in this story? And also, is there some connection between our spine, our spinal health, and our hearing?
So, so this story was definitely told to us in chiropractic school. One of our courses in first semester was the history of chiropractic.
Mm-hmm.
This that being said, the school that I attended was an evidence-based teaching school. All of the therapies that they taught us have research to support them being used. However, we did discuss this, and among the class, we would say, well, how is this possible? Could it have happened? Is there a possibility that there could have been pressure placed upon a nerve that could affect the hearing? The nerve that controls the hearing comes off of our brainstem. I suppose there's a possibility that perhaps a misaligned cervical vertebrae, an upper cervical vertebrae, could put some unnecessary pressure against a cranial nerve and affect hearing. It is not likely. I suppose it's possible. So I'm going to leave that at that. But it is a good story, especially to tie in with this morning's podcast. So.
Mm-hmm. So there's a very slight possibility. You're not ruling it out completely that maybe something wrong with the spine, maybe at the top, the cervical spine,
I suppose
maybe could
anything is
affect
possible.
hearing. Okay, okay.
Yeah.
It was worth asking.
Yeah.
That's what we say. Anything's possible,
Anything
right?
is possible. That's
Exactly,
correct.
exactly.
Yeah, so along those lines, some of the questions that I do get, and I'm sure this is not foreign to you, Dr. Russo, but how does chiropractic really help with ear infections? I know a lot of parents are concerned about considering surgical options and things like that for chronic ear infections. Is there any, I guess, evidence or anything that you've seen clinically that has shown to help in this area?
Yeah. So there has been some research to support the use of eustachian tube massage and lymphatic massage to aid in the drainage of the eustachian tube. So patients do bring their children into me occasionally for repeated ear infections. And I'll be very clear with the parents of these children. I'll say there's limited evidence to support this. However, if we have success and your child can avoid going in for a surgery to have tubes placed in, absolutely, we should try this. Always conservative first. And it has been my experience that some children do respond positively to the eustachian tube massage and some lymphatic massage. I also will gently mobilize the eustachian tube just by gently tugging on the ear. I can add in sometimes, depending on the child's age and if they can tolerate it, sometimes I'll take a hot cloth, lay it over their nose, maybe apply some menthol to try to open up the nasal passages. I can do some massage through the sinuses. And again, some patients respond very well to this, and some do not. For instance, my own child, my daughter Francesca, was getting ear infection after ear infection after ear infection, and we did have to bring her in, and she had tubes placed in her ears, and it resolved the issue. On the other hand, my oldest child, Julian, was also dealing with the repeated ear infections. I mean, cycle after cycle after cycle of antibiotics, and the tubes had been suggested. And in his case, I actually turned to another chiropractor for assistance. His name was Dr. Christopher Rose, and he was in Bergen County, New Jersey. Somebody recommended him to me. So he took a good long history on Julian. Julian was only about 9 months old at this point. And in the discussions, we told him Julian had terrible reflux. He was taking I believe Zantac every day for the reflux. So he did a similar style treatment to Julian as I do to my patients, but he discussed perhaps removing milk products from Julian's diet at that point. Julian had started eating solid foods at that point, so he suggested, especially in the evening before we laid him down for sleep, to remove the milk, the bottle of milk. He felt that perhaps the reflux was kicking some of the milk back up, into his eustachian tubes and causing the ear infections. With Julian, once we removed the milk products from his diet, and I kept up with the eustachian tube massage and lymphatic massage, he never had another ear infection. So Julian was able to avoid the surgery. So again, this is what I explain to patients. Everybody's different. There's no guarantees, but it is worth trying.
That's so interesting. I deal a lot. I don't know if you knew this, but part of my practice is actually in Bermuda, and they deal with a lot of mold in Bermuda. And so nearly every patient has eustachian tube dysfunction, like beyond belief. Like it's to the point where I've never really seen this incidence in adults, like such a high incidence of eustachian tube dysfunction. Do you think that it would work, given that I guess anatomically as we get older, the eustachian tube shifts a little bit, but maybe that massage and the lymphatic drainage could work
I
for adults
suppose
as
it
well?
could. My understanding is that with children, the eustachian tube has sort of a downward angle toward the back of the tympanic membrane. Is that correct? In children, it angles slightly downward, and as the head grows, it starts to level out. So draining those tubes with children seems to have benefit. I believe it could work with adults as well. I don't see why it couldn't work. It's just typically the people asking me are the parents of children. I don't usually have an adult asking me. I see far less ear infections in adults, so.
Yeah. Yeah, it's interesting because that's something that I didn't think about. Like if I have a patient who does have chronic eustachian tube dysfunction, suggesting potentially a consultation with a chiropractor could be an interesting thing.
Yep.
What about tinnitus and vertigo? That's usually another question that I get. Can chiropractic medicine help with tinnitus and vertigo symptoms?
So tinnitus, I have not seen any success as far as chiropractic treatment improving tinnitus. I myself suffer from tinnitus terribly. And I have I have had a lot of adjustments in my life. I have not found personally that it has improved my tinnitus. And I've never had a patient tell me that my adjustments have positively affected tinnitus. So not negatively either, but I haven't seen any correlation. Vertigo is an entirely different story. In my office, I see patients who are suffering from vertigo, I would say almost on a weekly basis. And ironically, they don't come to me because they're having vertigo. It's just in the setting that I work in, you're seeing patients on once a week, twice a week, sometimes 3 times a week. So there's a lot of conversation happening, and a patient will come in mentioning, "Oh my gosh, I have terrible vertigo. I couldn't get out of bed. The room was spinning." So when they mention that to me, I will offer a treatment for vertigo. And usually the treatment is going to be utilizing the Epley maneuver. Sometimes the patient has already been to an ENT. They've been told that they are suffering from BPPV, and they may have already had imaging of their head to rule out any worse scenarios. So if they've been already diagnosed with BPPV, I'll explain to them there is this maneuver called Epley's. And it's basically a repositioning technique to try to remove a canalith from the semicircular canals, which control the ability for you to to your balance. So I'll start off with the patient. I'll perform a Dix-Hall pike. For those that don't know that are watching this, the Dix-Hall pike maneuver is basically where you position the patient's head to one side or the other. A patient can usually tell you which ear they believe is the affected one. They usually know. So, for instance, if they told me that their right ear seems to be the problem, I would position their head to the right about 45 degrees. And I would lie them back on my chiropractic table, leaning their head slightly over the edge, and take a look at their eyes, looking for nystagmus, or a shifting of their eyes back and forth, and a subjective complaint of dizziness. If there is the complaint, that's a positive Dix-Hall pike test to for BPPV, to diagnose BPPV. You could then perform the Epley maneuver from that point, and essentially all you do is the same thing. You position their head 45 degrees toward the affected side. You lie them backwards. You wait about 30 to 60 seconds. Usually the dizziness would stop at that point. You would then turn their head 45 degrees to the opposite side, and they may feel dizzy again. You wait about 30 to 60 seconds, and then you would ask them to turn onto the side of their body, still with their head turned. And again, give it 30 to 60 seconds, and then you could slowly sit them up. This is a pretty effective technique at dislodging a canalith from the semicircular canal. There was a study that I pulled, research article that was published in the International Journal of Otolaryngology. This was in 2015. It was titled "The Efficacy of Epley's Maneuver in Treating BPPV Patients." What the study showed was that approximately 72% of patients felt immediate relief of their vertigo following an Epley maneuver, and over 90% of patients experienced complete relief of their symptoms within 1 week. So the Epley maneuver I use, again, almost on a weekly basis here. It's wonderful. So
it's really interesting, this connection, because I've also been diagnosed with vestibular issues. So not BBPV, but vestibular migraine and Meniere's disease. And when I see my chiropractor, I don't have the Epley maneuver, but what I do find is a lot of the time I have a lot of pressure in my head. I like the feeling of pressure, and it comes from the ear into my head. my neurologist thinks it might be migraine, then the ENT thinks maybe it's the Meniere's, and we're never too sure what's causing what problem. But a lot of the time I have this pressure. It can be very distracting and uncomfortable. And I also have a lot of everyday instability. So just feeling like just out of it, just kind of a bit off, not quite right, walking around. And when people are passing me, I feel a bit off balance. And I do find, and this is just anecdotal, I do find that after an adjustment, some of that pressure is released. So it could be, I know I have neck problems anyway. It could be, I guess, that my neck problems are not helping all the other things that are going on with my ears and my brain and everything. But anecdotally, it helps going to see a chiropractor for these conditions. And it's really hard to describe the benefit. I almost feel like I feel a bit lighter. I feel like my head's just, I keep using the word pressure, but it feels like there's less pressure in there afterwards. And it can be such a relief. So I don't know the science behind it. I've tried not to Google this too much because I know that there's a lot of things out there. There's a lot of unknowns around vestibular disorders. But yeah, anecdotally completely helps.
Yeah, you bring up a very good point. So in the patients that come to me suffering from vertigo, I will often see compensatory postural changes in these patients. Perhaps, keeping their head tilted slightly to the right or slightly to the left offsets the vertigo. And if held in that position for days, you'll start to develop muscular tightness on one side of the neck or joint restrictions on that side of the neck. So important to note that following an Epley maneuver, I often am going to also perform some soft tissue therapy on that patient, whether it be by massage, some electric muscle stimulation, hot packs, and I'm going to do some gentle mobilization through that cervical spine, where just making sure all those joints are moving nice and freely and loosely. So that's a very good point. So.
It's interesting hearing the kinds of treatments that you offer, because I've seen a couple of chiropractors. One of them solely did the general adjustment.
Spinal manipulation only,
yeah.
Yes.
And the other one was very much the one that I used to see, who I much prefer, is actually, he does very much what you're saying. He did a lot of soft tissue. He had different massage techniques and machines as well. He used, like you were saying earlier, he used menthol sometimes just to kind of help, promote better, well, you're talking about eustachian tube dysfunction, promote better airways, clear your airways a bit. He used a lot of different techniques as well as the actual manipulation.
Yeah, so definitely in my office, I employ a massage therapist here. So patients are in for deep tissue massages every day. I have a acupuncturist who works out of the office as well. And then I myself, I certainly don't just do spinal manipulation. It's one of my tools in my bag. But I have plenty of patients that I don't even perform spinal manipulation. I will just do soft tissue work. For people with herniated discs, I have spinal decompression tables, essentially mechanical traction tables to help decompress those herniated discs. So it doesn't just stop with spinal manipulation. So
good to know that there are lots of options, and like you said, tools in your bag to support patients. I think that's what we all try to do when we have a patient that comes in with certain complaints, hearing loss, tinnitus, vertigo, to have as many tools as possible to offer them relief and improve their quality of life, including coaching and the therapeutic aspect of it, the psychological aspect of it. So that to me is really interesting.
And just treating everyone as an individual, and actually thinking, what is it actually that they need, not treating everyone the same.
Correct. Take a holistic approach.
Yeah.
The patient, not just the symptoms, because everybody's different. So.
Yeah, exactly. Now, before this podcast, we all had a little chat, and you told us that you also have hearing loss as well. Did you want to tell us a little bit about that?
Sure. So around the age of 20, I apologize, guys. Sorry, people are looking for me, I guess. Around the age of 20, I started experiencing tinnitus. I'm fairly certain that I know that I did it to myself. I'm somebody who loves to listen to loud music, always have. Love when I'm driving, the music is always very loud. Um, so I can remember coming home late at night, whether it was from like a nightclub or something, and getting in bed and just hearing that ringing in my ears. And for a long time, it would stop. By morning, I wouldn't hear it anymore. But now I have it all day, every day. It tends to be much louder in one ear for me. It was in my left ear, much louder. And as was stated, my wife is also an audiologist and was in the same program as Dr. Reisman. So she brought me down to the CUNY Graduate Center, and you guys put me in a sound booth at the time. And I was diagnosed with unilateral hearing loss in the high frequencies of the left ear at the time. I did have imaging done of my brain to rule out any sort of tumor on my eighth cranial nerve, and that was normal. My wife at the time suggested I get some hearing aids, and I didn't want to put hearing aids on. I was the type of person that said, "Oh, I don't want to put hearing aids on. They make you look old." So over the past now 15 years, it has gotten worse. My hearing has gotten much worse. I find myself constantly asking, "What? What did you say? What did you say?" My wife rechecked my hearing and did find that it has dropped off even more in the high frequencies. So, about 5 months ago, with the aid of Dr. Reisman, I purchased my first pair of hearing aids. The hearing aids that she got me are completely inside of my ear canal, which makes me feel a lot better. Call it vanity or whatever. I didn't want to have a hearing aid that was showing behind my ear, but I wear these every day, and they're incredible. So I am not asking everyone, what did you say? What did you say? And I think the night that I first started to appreciate them most, we went to see our friend's husband play in a band in a nightclub, and we had dinner in that club. It was the first time that I sat at a table with about 8 people and didn't have to keep leaning as close as possible to everybody and reading their lips, which I have gotten very good at reading lips in a loud surrounding situation. I can sit and listen to everything that's being said at that table perfectly. I can hear what the people at the next table were saying. So I want to thank you, Dr. Reisman, for helping my wife get that particular pair of hearing aids.
Of course,
Because
we were plotting against you.
you know what? They're unbelievable. So you can throw a plug for those if you'd like. But I 100% think they're incredible. So
Awesome. I'm glad it was so life-changing and that it improved things. And I'm sure Stephanie appreciates it too.
I think everybody does. I mean, my office manager here, I'm generally sitting behind a wall at my computer typing notes, and she's somewhere else, and she'll say something to me. I'm like, what? I just keep saying what, but not anymore. So she's like, I can't believe how poor your hearing must have been. Also, my patients notice. Bear in mind, my patients are laying face down on a table with their head in like a piece of paper. So when they're talking to me, I had to literally kneel down next to the table and keep my ear next to their head to understand the conversation they were having with me. So it has changed my life completely. So thank you.
Amazing.
Wow. It's like a good advertisement for hearing aids.
Yeah, absolutely.
Get them as well, not just for yourself, but for everybody around you who's fed up of you saying what.
Yep.
Yeah, that I think I can't even like follow that story because it's such an amazing, hiatus, I guess, at the top the top of the mountain there. That was such a great. I'm so glad that it came full circle and that it's helped so much. And I think, like you said, it's a very inspiring story. Even to me, to know that what we do every day is actually helpful and benefit, because we don't always get to see the other side and get to see, the day-to-day improvements in someone's life. So that's really nice. Thank you for sharing.
Absolutely. And I will say, I do have, the advantage that my wife can fine tune these for me often. So I feel for patients who, have to come in for adjustments to their hearing aids and have to schedule appointments. I'm lucky that I could run over to an office on a daily basis and just, oh, I can raise this or lower this. But for if anyone's watching that is considering hearing aids, if you're struggling with your hearing, I mean, just go for it. The way that you would wear a pair of glasses, to correct your vision, go get the hearing aids. It changes your life completely. And the audiologists just do such a wonderful job with taking the time to make the proper adjustments. Just do it. Don't wait. Do it.
Perfect. I think that's a great way to end, and
Mhm.
I appreciate that, straight from the chiropractor's mouth.
Exactly.
Get help for balance, hearing, tinnitus, all of it, and it's really nice to see how we can all work together collaboratively, and everyone has their role, right? So the audiologist in the hearing, the chiropractor in the adjustments and things of that nature, and then the coach and the psychological support afterward, the ongoing support in the day-to-day life. So thank you so much, Dr. Russo, for being with us today. This was beyond insightful. I'm excited to even share it with everybody, because I'm like, you need to listen to this. This is great.
Thank you so much, Dr. Reisman. Thank you so much, Carly. I hope you guys have a wonderful day.
Thank you. You as well. Happy New
Thank you.
Year. All
Thank you.
good
You
things.
too. Bye-bye.
Bye.